My name is Boyd Shepard, attorney at law, and today I'm going to talk to you about Rule 108.7 of the Texas State Board of Dental Examiners Rules and Regulations. Rule 108.7, Standard of Care, lays out the different rules for what Texas dentists must do to comply with the standard of care according to the Texas State Board of Dental Examiners. It is a regulatory law. It has 13 different requirements. It's not the common law, but it reflects what the common law is. In this video, we're going to talk about the first three subsections of Rule 108.7. First, let's take a look at the rule itself. Texas Administrative Code, Chapter 108, Professional Conduct. Rule 108.7, Minimum Standard of Care. Each dentist licensed by the State Board of Dental Examiners and practicing in Texas shall conduct his/her practice in a manner consistent with that of a reasonable and prudent dentist under the same or similar circumstance. Further, each dentist 1. Shall maintain patient records that meet the requirements set forth in 108.8 of this title, relating to records of the dentist. 2. Shall maintain and review an initial medical history and perform limited physical evaluation for all dental patients, to wit: A. The initial medical history shall include, but shall not necessarily be limited to, known allergies to drugs, serious illness, current medications, previous hospitalizations, and significant surgery, and a review of the physiological systems obtained by patient history. A checklist for consistency may be utilized in obtaining initial information. The dentist shall review the medical history with the patient at any time a reasonable and prudent dentist in the same or similar circumstances would do so. The initial limited physical examination shall include, but shall not necessarily be limited to, measurement of blood pressure and pulse or heart rate. Blood pressure and pulse heart rate measurements are not required to be taken on any patient 12 years of age or younger, unless the patient's medical condition or history indicate such a need. We'll look at the rule in three separate subparts to begin. Subpart 1. Each dentist licensed by the State Board of Dental Examiners and practicing in Texas shall conduct his or her practice in a manner consistent with that of a reasonable and prudent dentist under the same or similar circumstance. In the very beginning of this rule, we see the language which is part of the common law for the definition of the standard of care, that language being of a reasonable and prudent dentist under the same or similar circumstance. This is the criteria for determining whether or not a doctor is acting within the standard of care. Subpart 1 says, each dentist must or shall maintain patient records that meet the requirements set forth in Rule 108.8 of this title, relating to records of the dentist. So, according to Rule 108.7, it is within the standard of care to keep or maintain patient records according to Rule 108.8. We'll be taking a look at Rule 108.8 separately in additional videos. The second part of Rule 108.7 states that a dentist shall maintain and review an initial medical history and perform a limited physical evaluation for all dental patients. Initial medical history is discussed in Subpart A, and the limited physical evaluation is described in Subpart B. Subpart A, The initial medical history shall include, but not necessarily be limited to, and then there's a list of items that can be included or should be included in an initial medical history. The rule also states that a checklist may be utilized to obtain this initial medical history. And then it says, the dentist shall review the medical history with the patient at any time a reasonable and prudent dentist in the same or similar circumstance would do so. Meaning, it is up to you, the doctor, to determine when it would be reasonable and prudent to obtain and otherwise update this medical history information. It is going to vary from patient to patient. Patients will initially tell you, upon request or inquiry, whether or not anything has changed in their medical condition or medical status or medical history. If so, obviously you would note the chart. However, there may be circumstances where the patient won't volunteer this information on their own, and you would have to ask them or obtain it otherwise through some sort of written questionnaire. This would be updating the medical history. Subpart 2B of Rule 108.7 discusses the initial limited physical evaluation. And it states that this shall include, but not necessarily be limited to, the measurement of blood pressure and pulse or heart rate. In the patient chart, what is required is the blood pressure and pulse at the initial dental appointment. This becomes the baseline for the record for this information. The rule then goes on to state in subpart 3 that the dentist shall obtain and review this updated medical history and limited physical evaluation, or otherwise obtain blood pressure and pulse, as often as a reasonable and prudent dentist would do so under the same or similar circumstances. Again, we see this language which is the definition or within the definition of the standard of care. You may ask yourself, well, how often is that? And the answer is as often as you see fit as the treating dentist. Obtaining blood pressure and pulse, it would be reasonable and prudent to do so whenever there's a change in medical history. It would be reasonable and prudent to obtain blood pressure and pulse each time you do a surgical procedure. It would be reasonable and prudent to do a blood pressure and pulse perhaps at every appointment, but for some patients you may only need to obtain this information every 6 months or once a year. Certainly if a patient hasn't been to your office for quite some time, you're going to review both because that's what a reasonable and prudent dentist would do. There's no time limitation. The rule does not say obtain blood pressure and pulse or review the medical history every 3 months or every 6 months or once a year, nor does it say that you have to do it at each appointment. It says that you do it as often as a reasonable and prudent dentist would do so, allowing you, the doctor, to be the doctor, to make these decisions based on the information that the patient is giving you. Rule 108.7, subparts 1, 2, and 3 discuss the obtaining of medical history, blood pressure, and pulse at the initial appointment, and reviewing these items as often as a reasonable and prudent dentist would do so. I hope this has been helpful. Thank you for your time. At the end of this video, you will find contact information should you have any questions. Thank you.